Health officials from across the region have been meeting in Lexington today to reassess their plans in tackling Ebola.
There are no confirmed cases of Ebola in Kentucky, but officials say they're watching other affected areas closely. WKYT Sean Moody has the latest on those plans in our top story at 12:30. Sean?
Well, state and regional health care professionals wanted this meeting to reassess how they would react if there was an Ebola case confirmed here in Kentucky. They say they've been watching the affected areas very closely. Officials talked about how they would react if Ebola showed up here in Kentucky, how they'd work to quarantine people, how they'd get rid of contaminated waste, and how all the agencies would communicate.
It was kind of to outline the systems that are already in place and to see where there may be some gaps and how that would work.
2 people in the past few months were quarantined at UK Hospital with Ebola-like symptoms. Their tests came back negative, but doctors say they were able to learn from them.
We've learned a lot of lessons, not only from that, but from previous exercises that we've had and from H1N1 pandemic, and so there's a lot of things that we have learned.
There have been no confirmed cases of Ebola here in Kentucky, and to catch it, you'd have to have physical contact with someone who was infected. Still, though, doctors say it pays to be vigilant.
I think the key for people to understand is that as long as the outbreak in West Africa is ongoing, there's going to be ongoing risk for having cases in the U.S., and we know we're more connected as a society than we've ever been in our past.
And health officials say they'll continue to reassess their plans and make sure other healthcare workers are aware of them. In Lexington, Sean Moody, WKYT.
Sean, thank you. And as the Ebola outbreak continues to dominate health headlines, doctors also said it's still important to pay attention to other health risks here in Kentucky, like the upcoming flu season.